Let us start with the outline of our topic. So we have, what do we know about COVID-19? Then second is China experience against infectious disease all through these years. What is TCM? Under what is TCM, we will have the definition, the two uniqueness of TCM, or what are the differences between TCM with other medical systems. Then the next one is the role of TCM. And after this, I will just only share some modalities of TCM and have a clinical case presentation later on. And lastly, we'll have the summary. Okay, so let's start with what we know about COVID-19. It is an infectious disease caused by a newly discovered coronavirus, which was first identified by China in late 2019. This virus is very contagious. When we say contagious, it means it is passed by contact and it's very fast in spreading. Most people infected with this disease, they develop mild, those people who infected develop mild to moderate illness and they recover even without hospitalization. It's about 80% of the total infected population, but it is very dangerous because it is deadly for those who have underlying conditions or chronic diseases, especially the elderly, due to having complications or they develop complications after. So according to US CDC, stands for Center for Disease Control and Prevention, they had a report as of February 2021, just this year, regarding the incubation period of COVID-19. They said 97.55% of people who have infected the virus, they develop symptoms within 11.5 days. So earlier than the 14 days period we often say. And the median is 5 to 6 days. Okay, incubation period means it is the period wherein a person has already contracted the disease before manifestation of symptoms. There are also few cases having their incubation period extended beyond 14 days. Just like in Hong Kong, if you are going to Hong Kong, they will require you, 21 days of quarantine. So because there are a few cases, even go beyond 21 days. So another report by Science News as of March 2021, patients from hospital after COVID-19 infection appear to have increased rate of organ damage compared with similar individuals in the general populations. So it's really a big problem we are facing right now. We see a lot of post-COVID patients nowadays. Based on our observation, this is not just applicable to those who were in severe or critical condition during their confinement in hospital during that time. We have also seen those patients who were in mild and moderate conditions also develop lingering symptoms too. Just had seen a patient this afternoon, and I will use his case as a presentation later on. So according to another retrospective cohort study, in England, nearly a third of individuals' population who were discharged from hospital after acute COVID-19 were readmitted. So the figure is out of 47,700 individuals in this study, 14,060 of them were readmitted. And more than 12% die after discharge. So it's really a great number. Today, we sometimes will hear from discharged COVID patients complaining on their condition. They feel so down, describing as if they would never recover or get out from this disease. So what are those symptoms that are manifested? And this is the list provided by World Health Organization, but it varies individually from person to person. The most three common symptoms are fever, dry cough, and fatigue. But when we say fever, some will experience having high fever, some might in low-grade fever, so in different degrees. And there are also patients who don't have fever at all during the onset period, and they develop to have fever later when their case get worsened. So that's the most common associated symptoms. And there are less common symptoms are body aches and pains because they catch cold. Okay, they have sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell. Okay, it means new loss of taste or smell. Okay, rashes on skin, and also some of them may have discoloration on their fingers or toes. And there are also serious symptoms, those who are already in the severe or critical stage, difficulty in breathing or having shortness of breath, and with chest pain and feel pressure on their chest, and also loss of speech or movement. It means they are already, okay, almost into comatose stage. Then conditions of patients usually will get worse, okay, majority after 1 week of onset symptoms manifestation, aside from those who are asymptomatic. Then COVID-19 is classified into 4 stages according to its severity. Okay, we have the mild, then from mild to moderate. Okay, when it is considered as moderate stage, you can see mild structural changes in imaging of their lungs, okay, from X-ray or from CT scan. So next one is severe stage. Okay, those who are in the severe stage will have difficulty in breathing, inadequate oxygen level in the body. Okay, when you test using the digital fingertip pulse oximeter, measuring the oxygen level, the figure is equal or lower than 93%. So if it's already in 93% or lower, must go to the hospital definitely. And the extent of lesion or injury in lungs, okay, see in CT scan is increased by more than 50% within 24 to 48 hours as shown on imaging. Then here is the critical stage. Okay, there's already respiratory failure, so they need to be incubated, oxygen incubated, and they may go into shock or into comatose, and often will have multi-organ system dysfunction. Most of the organs are already damaged. Here is an X-ray of my patients last year, as of March. Okay, you can see abnormalities or irregularities. Okay, on the chest X-ray with densities. Okay, which shown most on her left side chest, lungs, I mean. So in general, and as of now, it can be said that modern medicine is still in the stage of gradual discovery and continuous understanding on this disease called novel corona pneumonia, because this is really a new disease that never happened before. So now let's go to China epidemic experience. Among all the hard-hit nations by this COVID-19 pandemic, this virus, it is China who is able to contain the spread of this virus effectively in a short period of time. What are the secrets? How they can go after, okay, easily, okay? Maybe not the right word to say easily, but they are the one who really do their best, okay? So it's due to through strict implementation of rules and regulations by the government, and also discipline of its citizens in coordinating. And second, it's because they have early intervention or application of TCM. What is TCM? It stands for traditional Chinese medicine as the main treatment method in conjunction with Western medicine, okay? Such as CT scan, also intravenous injection. So the best is combination of both. So in the long history of Chinese civilization, China has accumulated a vast experience in how to deal with infectious disease, which are clearly discussed in those ancient literature. Okay, so the first literature I will mention here is called Su Wen of the Yellow Emperor Classic of Internal Medicine, or also known as Huang Di Nei Jing in Chinese. Okay, it's just like our Bible. Okay, that was compiled over more than 2,200 years ago. That states the 5 types of epidemics or plagues. Okay, we classify epidemic or the this pandemic as plagues are the same, which are all contagious, no matter what is the range of the scope or size. The disease symptoms are similar. And novel coronavirus under TCM is considered as plague and classified as nauseous or poisonous dampness. When we say dampness, it means moist or wetness. So the characteristic of this virus, according to TCM, it belongs to, okay, a substance that have the characteristic of having moist or wetness, and it is often associated with coldness. The organs initially affected are the lungs and spleen, then it may transform and transmit to other organs. In TCM, plague diseases basically are having the following characteristics from one stage to another, which are first dampness, then toxicity, blood status. When we say blood status, these are having blood clots, okay, due to stagnation and closure of orifices, then into exhaustion. So another Asian literature is called plague theory. It was written by Wu Youke, who was a famous doctor during the Ming Dynasty. According to him, plague is a disease not caused by wind or cold, neither summer heat nor humidity, but a kind of substance existed on air between the sky and ground that enters to the body through the nose and mouth, which will cause febrile disease. So you can see here how advanced is TCM during that time. They already know how it is transmitted. So in clinical practice, we have observed that the inflicted pathogens on patient's body or the pathogens that have attacked the body of the patient is not just the virus itself. It is often complicated. In diseases having viral infections such as COVID-19, we have observed and found out that patient's body is also attacked by other external pathogens such as wind, cold, and others due to weak defensive ability or having a poor immune system, as we often said right now. That is why it is necessary for us to, as professionals, to analyze and distinguish what are these pathogens that have attacked the body and how these pathogens enter the body through what channel, and it's often initially through the skin, okay? As what we often said in Tagalog, may lamig ang pasyente, right? Then it will penetrate deep into the inner body. That's why when we do palpation on pneumonia patients, we often will observe a thick layer of cold and dampness that have covered their body. No wonder COVID-19 patients, they will feel pain or body ache. It is due to these invaded pathogens that cause stagnation on the superficial area of their body. So, according to the book arranged and published, recently by China Academy of Chinese Medical Sciences, this is my alma mater, and I'm very proud being one of them, called Epidemic Records in China History. It has listed out 321 serious or severe epidemic experience encountered by the Chinese people way back the past 2,000 years, from 206 BC till the final years of the Qing dynasty, that is around 1900. Every single infectious disease that the TCM treatment and the TCM treatment strategies applied on each pandemic or epidemic, it is clearly stated and documented. So you can learn how they treat these plague diseases. So during the course of this COVID-19 pandemic in China, their National Health Commission and National Administration of Traditional Chinese Medicine has released rapid advice for frontline clinicians, the guidelines to follow in the prevention, control, diagnosis, and management of this novel coronavirus using, of course included there are also Western method, but which I'm going to point out is using TCM methods, are published there. It has reached to the 8th trial edition as of last year, which is the latest version. So now we go to the next. I'll give a short introduction on what is TCM. I said a while ago, TCM stands for Traditional Chinese Medicine. It is a medical system that is used in the treatment of diseases that is originated from China, which has been existed for more than 5,000 years. Maybe the oldest traditional medicine in existence. It is considered as a cultural heritage of the people. When we say cultural heritage, these are practices or habits of the people. It is also known as quintessence of Chinese culture that has been handed down. When we say cultural heritage, these are practices handed down from one generation to another generation. TCM is also defined as a systematic study of human physiology and pathology that is dealing with diagnosis, treatment, and prevention of diseases. Well, it sounds like also the definition of what is Western medicine, right? Because both of them are having the same goal, same objectives, which are to heal diseases, or maybe some will say treat diseases, not healing diseases. But in TCM, we heal diseases. So here, is what China National Committee for Terms in Sciences and Technologies, said. Based on them, the formation of traditional Chinese medicine is mainly, based on two things. One is practical experience. That's why sometimes we have to use common sense. Then another one is Chinese medical theories. So what are these theories? We have a lot, such as yin and yang theory, the 5 element theories, the 6 pathogenic factors, and the 7 emotional theory, the 12 regular meridians, and the 8 extra meridians theory, and so forth and so on, which we have limited time. We don't have time to discuss it in details one by one. So what I will share here now is the two uniqueness of traditional Chinese medicine, which it differs from other medical system. First is the concept of integrity or holistic approach. Okay, in TCM, we believe that our body is composed of different organs and systems that are interrelated and interconnected by meridians and collaterals with acupuncture points, okay, as stations. It is a complex system that cannot be separated. You cannot say, I just only treat your kidney. I cannot treat your lungs. So in TCM, it's holistic, okay? But right now we have specialty, really, okay? And it says, for one organ has problem, other organs will then be affected. And this is why we treat not just only the disease itself, but a person as a whole at its root cause, just like COVID-19. First, it invaded the lungs and the spleen, then later it will affect the liver, okay, the kidney, okay, and then the heart, okay? So what are meridians and collaterals? These are the pathways where energy and blood flow, aside from the other blood vessels, okay? Then the second uniqueness of TCM is syndrome differentiation. TCM practitioners, of course, okay, has to analyze the characteristic of a symptoms a patient has manifested. For example, having the same disease, but symptom manifestations may have differences. So we have to analyze them in order to provide them the right kind of medication. To do this, a practitioner definitely has to apply the basic 4 traditional Chinese medicine diagnostic methods in collecting the necessary information and data through, okay, what? Observation by looking, smelling and listening, questioning or interrogating, and then have to do pulse reading on patients, and then palpation on the body, enable to distinguish the characteristics of the disease in relation to patients' body constituents. With the advancement of science and technology, okay, we may have it also supported with data such as requiring the patients to have blood tests, okay? So based on the blood chemistry test and also imaging reports such as CT scan, okay, MRI, X-ray, as well before making the decision, able to select the best treatment methods and what technique or techniques have to be used. Okay, this is a picture of my friend, okay, but he was not under my care, but he had chat with me and sent me the pictures he had. I think he is under another TCM doctor's care, okay? On the left side, the first picture, you can see, okay, there on his tongue with a very thick white, we call that fur, okay, coating. So what does it mean? Based on TCM diagnosis, okay, the color is pale, so he's weak in energy. And then with the thick fur, which is color white, it means it is a cold symptom. So actually majority of the patients whom I, okay, not many, okay, have consulted me, okay, most of the symptoms are having cold symptoms, okay, because what is the characteristic of COVID-19 virus? As what I said a while ago, it is classified as nauseous dampness. And dampness is often having mixture with coldness. That's why how it is manifested on the tongue. When we see the tongue, it means, okay, it represents the body, okay? So it go worsen, then he get hospitalized. And you can see on the second picture, this fur become thickened much more. And you can see the tongue is not that firm anymore. So it means to say the energy level, okay, decreases. Then after becoming negative, okay, he discharged from the hospital. Then you could see the transformation of this disease into heat syndrome. So the tongue changed to very reddish, and you cannot see those fur anymore because it burnt already. Okay, so that's how we diagnose patients through the diagnosis or observation of the tongue. So another one is the definition from China National Committee for Terms in Sciences, and Technologies. So they said TCM is a comprehensive science. Okay? It's very broad in the study and research of human life and activities, pattern of diseases, and its transformation and prevention, which include diagnosis, treatment, rehabilitation, and healthcare. So from here, okay, we can see TCM mainly involves in three aspects or the role of TCM, okay, which is the main topic for today. First one is prevention of diseases, or we often said right now, prophylaxis. Then the second one is treatment or curing the disease radically as soon as possible, okay, and how to, okay, prevent from aggravating or getting worse. And the third role is aftercare or for further recovery to prevent from incurring new diseases. So in prevention, as early as before 770 BC in China, traditional Chinese medicine has already emphasized in literature the importance in the prevention of diseases before its onset, which can be found and read from an Asian literature, which I mentioned a while ago called Su Wen of Huangdi Neijing, that discusses how to tune in the spirit during the 4 seasons. It states, the saints do not treat diseases, instead heal diseases before its onset, not waiting till the disease to become complicated, rather to intervene and treat it before having complications. It also says, do not wait till to become thirsty. Okay, when a person, okay, do not wait till becoming thirsty, then start to dig well to get water, and starts to prepare weapons when there is a war. Then it will be too late. So in TCM practice, we give much weight or importance in the prevention of diseases or prophylaxis in order to contain the transmission of this novel coronavirus. In China, many provinces and municipalities have their own TCM experts to prescribe their own formulas as preventive measures based on their environmental factors, differences, and characteristics of their body constituents in order to protect those susceptible people in acquiring the disease. Okay, who are those which are susceptible? These are the frontliners, of course, the nurse, the doctors, the policemen, okay, these frontliners. So as of early March last year, my associate in Wuhan, Hubei, they had forwarded me 2 formulas which used in Hubei for frontliners as prophylaxis last year. So here, okay, is formula number 1 and formula number 2. If you are interested to have it, maybe you can contact me or with Madame Lilian. Okay, I can give it a copy to you, and you may have it presented to any Chinese drugstores of your choice, and they can arrange it for you and drink it as tea. Okay. So here on this picture, you can see a staff of mine here in Manila in our clinic. She is pouring and preparing for a drink. Okay. So this, okay, the mentioned formula earlier, these two formulas have the effects of what? It can clear away the internal heat and also for detoxification, expelling of dampness and turbidity, and can also enhance one's immunity to against infection. Okay, as mentioned earlier in the guidelines set by the National Health Commission and National Administration of Traditional Chinese Medicine of the People's Republic of China, okay, there within are two sets of herbal medicine recommended. Okay, right now we are speaking on treatment, okay, to be used during the medical observation period according to syndrome differentiation. When we mention medical observation period, is the care or medicine given to patients during the first 6 to 24 hours, sometimes can be longer, okay? It is the time that if you are suspecting or you having contracted the virus, okay, or you have close contact with those who are infected, okay, before going into confinement, then these are the two formulas that are recommended, but should be, okay, analyzed properly, and these are classified into two types. First, we have the cold syndrome, okay, the patient will have fatigue with gastrointestinal discomfort, such as diarrhea. Then it is recommended to take a medicine which you can also find in majority of the Chinese drugstore here in Manila, called 藿香正气 capsule or pill in the form of pill or water or oral liquid. Okay, how to analyze it? Okay, basically, if you look at your tongue, but of course we do not recommend self-medication. Okay, the color of the tongue is pale and having thick, okay, white coating, such as the picture I had shown before a while ago. Then the another type is called heat syndrome, having fatigue with fever, okay, can select from the following, okay, 金花清感, okay, granules or 莲花清瘟, okay, which is very popular right now, capsules, but must be very careful, okay? If the characteristic of the pathogens and the manifestations is belong to the cold syndromes, if you take this one, it will worsen your condition. So must be very careful. So again, do not do self-medication, okay? There's another one called 疏风解毒 capsule or granules. Actually, recommended right now is in granule forms, which is much more convenient, okay, and much more effective in, but depends on which company who produces it, okay, because some of the companies, they still use the low-tech technology, and there are those advanced company, they use high technology, okay, some are with also nanotechnology. So when come to treatment, if confirmed positive, then you don't use those medicine anymore, okay? So what medicine is recommended most? It's now the 清肺白肚汤, or we call that, or translated as lung cleansing and detoxifying decoction. So this 清肺 decoction is recommended as a general prescription, suitable for all patients in different conditions, whether having mild, moderate, or in severe condition, and may be used as a supportive treatment to Western medicine on those who are critically ill. This formula is consisting of 21 ingredients, And there are also other listed herbal formulas to be used, but it must be prescribed by TCM doctors based on the syndrome differentiation. But we don't have time to discuss it, so we'll go ahead to other next page. Okay. So the reason why China National Health Commission and National Administration of TCM strongly keeps on recommending the use of this formula. Okay, if anybody or in any place having symptoms, okay, that's the #1 recommendation right now. So because why they keep on recommending is because it has achieved a clinical effective rate of 97.78%, almost to perfect, on patients having mild and moderate symptoms. And none of the patients who took it has turned into severe or become critically ill, unlike the other medicine, which I don't like to mention the name, okay? Although it helps in releasing the symptoms, okay, eradicating the symptoms, but there's still the chance to turn into severe or critical condition. Then another one is clinical study has proven and indicated the early use of Qingfei Baidu decoction can significantly improve and shorten the clinical recovery period and has achieved a clinical effective rate of higher than 80% when, okay, used across all stages. So in mild stage, moderate, severe, and critical. So this formula is neutral in nature, so no need to worry about the expertise of the TCM practitioner in doing the syndrome differentiation, okay? It's either cold symptom or heat symptoms can use this formula. And that's the, okay, wisdom of traditional Chinese medicine. So in the guideline, okay, are also recommendation for recovering stage. There are 2 listed formulas recommended to be prescribed for those patients who are in the latter stage of the disease known as recovery stage. Patients even become negative in tests and discharged from the hospital often still have residual heat within the body. That's why you can see their tongues are still reddish, okay? With heat within their body that has not yet totally eradicated. Others have developed to become, okay, classified as yin deficiency or body fluid insufficiency, okay, due to the heat that has transformed, that have dried up the fluid in your body. And others have become energy or qi deficiency, okay, and that's why still having difficulty in breathing and also in curing digestive system problems, okay, in different degrees and etc. Okay, still other symptoms will be manifested. So the need for continued treatment is very necessary. If not, okay, it may lead into other diseases as what is happening right now. So clinically, we do not just only follow exactly the stipulated formula as is, but have to do some modifications according to the existing symptoms a patient is having, okay? Even classified under the same syndrome category, still it varies individually from person to person. Generally, okay, it is classified into 2 types, okay? These are classified into 2 types. First is the lung and spleen qi deficiency syndrome, okay? These are the clinical manifestation under this category. The patient still, okay, having shortness of breath, fatigue, no appetite, nausea, bloated stomach, weakness in eliminating stool or having loose stools. Then you can see on their tongue, color is pale and become weaker, with greasy white fur, as what you had seen a while ago on the picture, okay? The second one, okay? Then what are the treatment objectives, okay, in TCM? So we have to invigorate the energy or the qi and to strengthen the spleen and stomach functions. Another type is both deficiency of both qi, okay, energy, and yin. Okay, so the clinical manifestation are fatigue, shortness of breath, dryness in mouth, thirstiness, palpitations, excessive sweating, poor appetite, having low-grade fever, dry cough, or still with phlegm. Can see from their tongue, okay, looks dry with less fluid, okay, and the fur is thin, okay, or I mean to say the pulse is thin or weak in characteristic. Then the treatment objectives are to invigorate energy, the qi, and nourish body fluid, the yin, then at the same time dispelling the dampness and clearing those obstructions on the passages or on the meridians and collaterals. Okay, so during COVID-19 pandemic in China, China herbal decoction soup is used as the main treatment modalities. Okay, among all the modalities, it is considered as the first choice. Okay, there are also other modalities as well that are involved in order to produce, okay, synergistic effect in facilitating the healing process. Okay, so we call it comprehensive treatment methods, such as acupuncture. When we say acupuncture, it is the insertion of very fine sterilized needles into the skin where specific acupuncture points are located for the purpose of clearing away the obstructions in the meridians or pathway where the energy and blood flow in order to correct various ailments. So you know now what is acupuncture for, okay? Okay, to what? Clearing away the obstruction. That's the main purpose. Okay, you can see here also, okay, the one distributed in the hospital there in China, this that soup called Qingfei decoction, lungs cleansing and detoxifying decoction. Okay, that's the appearance of it. Then right now, okay, because of the modernization of traditional Chinese medicine, okay, we used to cook, okay, and boil the herbs for several hours maybe, and then it's very inconvenient due to new technology. Okay, it's already in the form of granule form. Okay, so these are also the new form of medicine given to those COVID-19 patients. Just only need to pour newly boiled water, stir it, and ready for drinking. Then also acupuncture, okay, needle used for insertion, okay, at P6 acupoint, pericardium 6 acupoint, okay. It is very effective, especially the patient is having nausea, okay. Then another modalities in TCM, which we often consider as the most powerful weapon in TCM, is called moxibustion. It is a heat therapy manipulated by igniting herbal preparations, then applies the heat generated from it to stimulate on specific acupoints or meridians in order to regulate body system. So they are having the same purpose also, but instead of using needle, okay, we use herbal heats. And there are some diseases that is much more preferable to use moxibustion because of its better effectiveness, I can say, okay? And that's why in Chinese also, it often works together in conjunction. That's why in Chinese, we don't just only call 针, or we don't just only call moxibustion, but we call it zhenjiu, the combination of needle and moxibustion. So according to clinical studies, moxibustion can adjust the body immune system function, improve the body resistance, and has the ability to not just only treat the diseases, but also used for prevention of diseases. Research studies have shown that application of a certain brand called China Moxibustion, okay, and it's in a patch form, which has Chinese herbal within. When you put on a acupoint called Da Zui acupoint, which is at the back of our neck, okay, the pointed bone there, okay, has the ability to increase the total, okay, I will explain it scientifically right now, okay, has the ability to increase the total peripheral blood leukocyte count in human body, which can also promote T cell transformation functions and improve T cells count. At the same time, can strengthen macrophage function and carry cells activity. And if you do this rapid test, okay, increase significantly the IgG serum level. So here on the picture, you can see, okay, patients having COVID-19 in the hospital, a medical practitioner, okay, is applying, okay, as shown on the picture, a moxibustion patch on this back of her neck. And you can also see, okay, this patient's kidney already affected. They then put the moxibustion on the kidney acupoints, which are located at the back of our lumbar. So another modality which I will briefly introduce is called Tuina. Tuina is also known as tendon manipulating technique, which is very effective for those musculoskeletal problem patients. And that's also my specialty, which is a specialized medical massage modality of TCM. It is a skill exerted with strength and stroke varieties by hands or elbows of the practitioner on patient's body. Service to stimulate acupuncture points and meridians. Okay, what meridians again? These are where blood and oxygen flow in order to regulate the body's physiological and pathological conditions. Clinically, we have observed and often found on those patients who have pneumonia, such as COVID-19 or asthma patients, their body are often covered with a thick layer of pathogens. After using Tuina methods to stimulate those affected areas, could ease their discomfort immediately, okay, if the practitioner is really in high caliber, and could help in facilitating the recovery. So you can see here on this picture, a kid who was 3 years old during that time, been going in and out from the hospital due to asthma attack. Okay, if I'm not mistaken, 16 to 19 days, 19 times, okay, since childbirth. Okay, so we use the Tuina method, okay, to release those pathogens on the superficial area first before letting him put the moxibustion patch. So in the hospital that treats COVID-19 patients in China, okay, because some of them are already psychologically affected, they use this called air beads, okay, to fasten or attach on the reflexive area of the ear. Okay, these are also considered as acupuncture points to stimulate it. And it has a very effective treatment in those patients, which can calm their minds, okay, and give them relaxation, okay, same as the application of using herbal foot soap, okay, and just dig or put both feet inside a bucket of herbal soup with aye, we call that ingredients, okay? And then keep it for less than 20 or 30 minutes. Then those people who are having psychological problems, okay, and they cannot get asleep very well. So they try this and majority of them have very good result. So for those, okay, who are not, okay, easy to get asleep or having problems in sleep, you may try this. So today, okay, I met a new patient, okay, and I use it in this clinical case presentation. So it's dated today, June 9, 2021, just this afternoon. He's a male patient, 46 years old, living in Valenzuela, Philippines. He went to the clinic, okay, with his wife accompaniment. Okay, the complaints he had is having breathing problem and difficult in walking. The medical history are he contracted COVID-19 and tested positive in March this year, but he was asymptomatic. Then had 14 days of self-quarantine. Then after that, okay, had another check and it became negative already. But during the quarantine period, he's had self-medication. He took 2 kinds of Chinese herbal medicine that are both very cold in nature. I don't want to name the brands, okay, the name, okay? And started to feel chest congestion and breathing problem right after. Then, okay, after quarantine period, then he was hospitalized on May and diagnosed of having what? Constricted heart blood vessels. Why like that? Okay, because plenty of coldness in the body. Okay, just like if you put a piece of meat inside your wrap, okay, you could see what happened. It tightened up, okay? It tightens up and become very hard. And okay, if there are also blood vessels, it will become constricted. But from the test, the lungs are clear. And I checked his pulse, okay? It was 72 beats per minute, okay? And when I feel the characteristic of the pulse, there is a little dilated, okay? Pulse belongs to the heart, okay, due to medication to dilate blood vessels, okay? And he is having a weak, okay, lungs and also a weak liver pulse. And the characteristic of his spleen and stomach pulse is slippery, and both lower jaw, okay, the lower area below the stomach from lumbar down there, okay, the pulses are tight and more on the left side. So this is the picture I took this afternoon on him. Okay, you can observe the tongue is also very pale, and you could see a very, very thick white coating on his tongue. Okay, so it is classified as coat syndrome. So I also did palpation on him, and I felt more dampness on, okay, a meridian called urinator bladder meridian, and also in front of him, the REM meridian in TCM, particularly on the stomach area, okay? And I found also tightness on the shoulder area, front shoulder area. There are 2 acupoints called Zhongfu, okay? It's LU1 acupoint and Yunmen LU2 acupoint, okay? And more tightness on the left side. So we do syndrome differentiation, okay? It is classified as having deficiency, okay, of lung and spleen energy or lung and spleen qi. Then what are the treatment objectives? Okay, we have to apply. First is to, okay, eliminate the coldness and dampness that causes stagnation. Then at the same time, we have to, okay, do invigorating and promoting the flow of the qi or energy, okay? So the treatment we did, okay, we use first, okay, we use comprehensive treatment methods in TCM by applying first tuina with the aid of tapping, or we call that ventosa, and also scraping on the affected areas for eliminating the pathogens on the superficial areas and release the tightness, okay, on the muscles, okay, particularly on the lower legs. Then use acupuncture needles to stimulate and release further the stagnations, so to smooth and relax the soft tissues, enable, okay, you have to soften it, enable, okay, to promote the normal flow of qi and blood in the meridians. Then we also prescribe herbal decoction to treat further the internal disease problem. So treat it externally, also with internal application also, okay, using both internal and external applications. On the right side, you can see those Chinese words. This is the formula I prescribed to him, okay? So now let's go to the summary, okay? Until now, many still do not really know about the real ability of TCM and how far advancement we have achieved. Although TCM is an Asian medical system, nonetheless, it is an evolving science. We are already now in an era of TCM modernization. It is not a test anymore. We are already here. With the aid of advanced modern science and technology, we are able to solve a lot of problems which cannot be solved before, okay? The previous problems on herbal medicine we were facing before can now be solved, okay? Herbal medicine can now be safely detected through strict standards. Those toxic elements can now be eliminated, such as the presence of pesticides residue, heavy metals, flavacin, sulfur dioxides, and etc. through advanced scientific methods. Okay, so please do not stick to the wrong notion that TCM is a pseudoscience. During this pandemic, TCM have shown and proven to the whole world the strength and ability that has excelled more than any other medical system in the treatment of COVID-19. Today, TCM has already transformed into traditional medical sciences, which has gone beyond the scope of Western medicine or Western medical theories and the breakthrough the framework of traditional Chinese medicine. During this pandemic, it has opened the eyes of many, in which the Chinese medical system is now in high demand and acceptance. It will be widely accepted and becoming a trend for international practice. That's the end of my reports. So thank you very much to all of you, and always stay safe.